Imagine a group of young people in Southeast Idaho, full of potential and dreams, yet facing a reality where they are significantly more likely to contemplate ending their own lives simply because of who they are. For many young people in Southeast Idaho, the journey of adolescence involves navigating school, friendships, and discovering their place in the world. But for the LGBTQ plus youth, in this region, this journey can be compounded by feelings of isolation, the struggle to find acceptance, and the fear of discrimination. Now, picture some of these young people rejected by their family simply for being who they are, left without a safe place to sleep, and feeling utterly alone. This stark reality highlights the critical vulnerabilities faced by LGBTQ plus youth, even within our local communities. My name is Justine Kohn, and I want you to follow along as we delve into the problem, need, and opportunity for LGBTQ plus youth in Southeast Idaho. We will be using the frameworks from topics 4 and 6 to discuss the community's dimensions, available data specific to or relevant to Southeast Idaho, assets, structure, and capacity in this region. And with the information gathered, we can identify a framed social problem with a working hypothesis tailored to this locality. Let's begin by identifying the focal community, LGBTQ plus youth within Southeast Idaho. This is primarily a non-place community connected by shared identities and experiences. However, the geographical context of Southeast Idaho shapes its specific dimensions. Its functions include providing crucial social support, a space for identity affirmation, opportunities for mutual aid, and a platform for advocacy, with these aspects being geographically localized or reliant on specific regional resources and online connections due to the area's characteristics. The population here comprises young individuals in Southeast Idaho identifying across the LGBTQ plus spectrum. The unique intersectionality within this rural context includes the influence of the dominant culture, socioeconomic factors specific to the region, and access to resources that differs from more urban areas. The geographical boundaries are defined by the counties that constitute Southeast Idaho. The culture of the LGBTQ plus youth community in this area is influenced by the generally more conservative social and political landscape, leading to a greater emphasis on discrete online communities, smaller local support networks, and specific ways of building resilience. Family acceptance within the close-knit hyper-religious community has a significant impact, either as a strong support or a source of considerable challenge. Presenting existing data requires a specific focus on or relevance to Southeast Idaho. Data on LGBTQ plus youth at this granular level can be limited, necessitating the use of broader Idaho statistics or national data with careful consideration of potential regional variations. According to the 2021 Idaho Youth Risk Behavior Survey, 21.3% of Idaho high school students reported being bullied on school property in the past year. While the data from the 2023 Idaho YRBS for these specific indicators isn't yet readily available, national trends from the 2023 CDC YRBS shows that 39.7% of students experience persistent feelings of sadness and hopelessness, and 19% reported being bullied at school. Given the additional stressors faced by LGBTQ plus youth, it is reasonable to infer that these percentages are even higher within this population in Idaho. Regarding mental health, while direct data for Southeast Idaho might be limited, Idaho's statewide statistics on youth mental health indicate that in 2021, 21.3% of Idaho high school students seriously considered attempting suicide. However, data from the Trevor Project 2024 survey on LGBTQ plus youth in Idaho reveals a much higher rate, with 38% of LGBTQ plus youth in people in Idaho seriously considering suicide in the past year, including 43% of transgender and non-binary youth. This significant disparity underscores the amplified mental health challenges faced by LGBTQ plus youth in Idaho, likely mirrored in Southeast Idaho due to potentially less access to specialized affirming care and greater social stigma. Concerning discrimination and harassment, the GLSEN 2021 National School Climate Survey State Snapshot for Idaho found that 68% of LGBTQ plus students in Idaho experience verbal harassment at school based on their sexual orientation, and 56% experience it based on their gender expression. Furthermore, 34% were prevented from using their chosen name or pronouns at school, and 29% were prevented from using the bathroom aligned with their gender identity. The experience of LGBTQ plus students in schools in Southeast Idaho undoubtedly varies based on local school district policies and community attitudes, but these statewide figures highlight the pervasive nature of discrimination that likely impacts students in the region. Homelessness among LGBTQ plus youth is a documented concern in Idaho. While specific state level data on the exact number of LGBTQ plus youth experiencing homelessness in Idaho is limited, national research by the Trevor Project indicates that 28% of LGBTQ plus youth reported experiencing homelessness or housing instability at some point in their lives. This is more than twice the rate of their non-LGBTQ plus peers. Given the potential for family rejection in the more traditional social environment and hyper-religious Southeast Idaho, LGBTQ plus youth in this region are likely overrepresented in the state's homeless youth population. Access to healthcare, including gender-affirming care in Southeast Idaho, is limited compared to urban centers like Boise. While specific numbers of affirming providers in Southeast Idaho are not readily available in a single database, like OutCare Health and QueerDoc, list a few individual mental health practitioners in Pocatello who identify as affirming. You can also use the website of Flourish Point to find individual mental health practitioners in the Upper Valley area. Additionally, St. Luke's Health System has stated its commitment to LGBTQIA plus patient care, though the extent of specialized gender affirming care, specifically in their Southeast Idaho facilities, is dictated by local policy. Barriers such as distance to Boise or Salt Lake from major urban centers with more comprehensive services, a smaller number of specialized providers in the Southeast region, and potential insurance coverage limitations likely restrict access for LGBTQ plus youth. Telehealth options for providers like FullX Health may offer some alternatives, but not fully address all needs. Regarding substance use in Idaho youth, the 2024 Idaho Substance Misuse Prevention Needs Assessment indicates that in 2021 2022, 11.8% of Idaho adolescents aged 12 to 17 reported past year marijuana use, which is higher than the national average. Research by the Trevor Project has also shown that LGBTQ plus youth are more likely to use substances as a coping mechanism for minority stress, with over half, 56% of LGBTQ plus youth using alcohol in the past year, and over 1/3, 34%, using marijuana. This suggests that LGBTQ plus youth in Southeast Idaho facing unique stressors may also be at higher risk for substance use. The available data underscores the significant challenges and vulnerabilities faced by LGBTQ plus youth in Southeast Idaho, highlighting the critical need for more localized research to accurately assess and address their specific needs. Despite the challenges, the LGBTQ plus youth community in Southeast Idaho possesses identifiable assets. Key values within this community include a strong sense of resilience in navigating a potentially less accepting environment, the presence of close-knit support networks fostered by organizations like Flourish Point, Idaho Falls Pride, Rexford Pride, and All Under One Roof LGBTQ. A high value placed on authenticity within trusted relationships, nurtured within these safe spaces, and a specific form of community building adapted to the local context, often relying on the dedicated effort of these organizations. Strengths and resiliencies are evident in the strong reliance on online communities for connection, resourceful individuals who act as local advocates, often connected with groups like All Under One Roof, the deep bond within small support groups facilitated by Flourish Point and local pride organizations, and a pronounced sense of self-developed in response to adversity, often supported by the affirming environment created by these groups. The power structure in Southeast Idaho includes formal leaders such as heads of local LGBTQ plus organizations like Flourish Point, Idaho Falls Pride, Rexford Pride, and All Under One Roof LGBT, as well as leaders within any active school, GSA, gay straight alliances, and informal leaders who are respected individuals within these networks or vocal advocates online and within these community groups. Social policies impacting LGBTQ plus youth in Southeast Idaho are complex. Idaho does not have a statewide law explicitly prohibiting discrimination based on sexual orientation or gender identity. School district policies on LGBTQ plus inclusion vary significantly across the state, and specific policies in Southeast Idaho districts can be examined individually. Regulations governing healthcare access within Idaho have become increasingly restrictive regarding gender-affirming care for minors. Currently, there are no known comprehensive local ordinances in Southeast Idaho that explicitly prohibit discrimination based on sexual orientation or gender identity in areas like employment, housing, and public accommodations, although some municipalities elsewhere in Idaho have such ordinances. The absence of these protections at the state and potentially local levels underscores the importance of the advocacy work done by organizations like Flourish Point, Idaho Falls Pride, Rexburg Pride, and all under one roof. The state senators and representatives for the relevant districts in Southeast Idaho hold varied perspectives. Senator Mark Nye, Democrat of Pocatello, consistently demonstrates through his voting record a commitment to LGBTQ plus rights and inclusive policies, often standing in contrast to the more conservative trends in the region. In contrast, Senator Doug Ricks, Republican from Rexburg, representing a more conservative area, has often emphasized parental rights in education and healthcare, suggesting a cautious approach or opposition to LGBTQ plus specific protections, aligning with the restrictive legislation seen recently. Similarly, Representative Barbara Earnhardt, Republican of Idaho Falls, has been a vocal advocate for conservative stances on gender identity in schools and youth health care, indicating likely support for policies limiting pronoun usage and restricting gender affirming care. Senator Jim Guthrie, Republican of Pocatello, while also leaning conservative, may get some pushback in his approach because of his specific district. Currently, as mentioned, Idaho lacks comprehensive state level anti discrimination laws, explicitly protecting individuals based on sexual orientation and gender identity. Therefore, the voting records and public statements of these representatives regarding broader human rights, youth issues, and any specific LGBTQ plus legislation, such as recent debates around gender affirming care bans and pronoun policies in schools, directly influence the legal and social landscapes of this community. These varied perspectives directly influence the policy landscape for LGBTQ plus youth in Southeast Idaho. The emphasis on parental rights has manifested in recent discussions and policies within school districts 91, 93, 251, and 321 regarding the need for parental permission for teachers to use students' preferred names and pronouns. Furthermore, the conservative legislative trend has resulted in laws limiting gender affirming healthcare for youth and restricting access to transgender healthcare in facilities accepting Medicaid. These legislative actions and school district policies create significant challenges for LGBTQ plus youth in Southeast Idaho, impacting their mental health, safety, and access to essential care. Examining the structure and capacity of resources in Southeast Idaho reveals specific formal and informal support systems within the region. Formal resources include local LGBTQ plus support groups and centers that we have mentioned so far, such as Flourish Point in Rexburg, which provides support groups and connects individuals with affirming mental health professionals. Idaho Falls Pride serves as a central hub for events and resource information in the Idaho Falls area. In Pocatello, all under one roof, LGBT Advocates of Southeastern Idaho offers a community center and various support services. While comprehensive data on the exact number of LGBTQ plus affirming mental health providers in these specific cities is still developing, resources like the referral list maintained by Flourish Point indicate their presence. Additionally, some school counselors and nascent GSAs may exist within local schools and colleges, though their accessibility and level of support can vary. One of the significant difficulties in establishing and maintaining active gay-straight alliances, or GSAs, in schools across Southeast Idaho is the frequent requirement for parental permission to participate. This presents a substantial barrier for many LGBTQ plus students who have not yet come out to their parents due to fear of negative reactions, yet who would greatly benefit from the safe and supportive environment these organizations provide. The risk of being outed without their consent and the potential for familial conflict often outweighs the desire for connection and support that a GSA could offer. Furthermore, the region's prevalent religious beliefs often contribute to a lack of parental approval for LGBTQ plus culture and practices, leading to active opposition to their children's involvement in such groups. This dynamic creates a challenging environment for fostering inclusive school communities and ensuring that vulnerable LGBTQ plus youth have access to the peer support and resources they desperately need. Connections to larger statewide organizations like the ACLU of Idaho and the Pride Foundation also provide broader legal and advocacy support. Access to these formal resources is often limited by geographical distance, the number of available providers, and the capacity of local organizations. Informal resources are significant, encompassing online peer networks that connect youth across the geographically dispersed region, trusted friends and family members who provide crucial emotional support, and supportive teachers or community members who act as allies within their local context. The patterns of influence, control, and service delivery in Southeast Idaho are shaped by the localized context. Influence often stems from local community leaders, school boards who determine inclusivity policies, and the dedicated individuals leading organizations like Flourish Point, Idaho Falls Pride, and all under one roof. Control is significantly exerted by state policies, particularly those impacting education and healthcare, as well as local funding decisions that can impact the sustainability of community-based organizations. Service delivery relies heavily on the efforts of these smaller local organizations and individual volunteers, often facing challenges related to limited funding, volunteer capacity, and the vast geographical area they aim to serve. To gather information from within the LGBTQ plus youth community in Southeast Idaho, I have primarily reviewed online discussions and reports to understand their experiences. Sources like Reddit threads on our Idaho offers insights into the challenges faced by LGBTQ plus individuals in the state, including feelings of alienation, anti-trans comments, and restrictive legislation. Some threads highlight that Pocatello is more queer-friendly than other parts of Southeast Idaho. The Human Rights Campaign, or HRC, Municipal Equality Index scorecard for Idaho Falls provides data on non-discrimination laws and LGBTQ plus equality in that specific city, offering a glimpse into the varying levels of support across the region. This scorecard indicates that Idaho Falls, or Idaho in general, is at high risk of discrimination. Through this process, key themes regarding the social problems, needs, and opportunities in Southeast Idaho have emerged. Prominent concerns include the necessity for more visible, safe spaces within the region, increased acceptance and understanding within schools and the broader community, improved access to affirming mental and physical health care locally, and the demand for stronger local support networks. Opportunities exist in leveraging existing community connections, particularly online, to build alliances and raise awareness, and advocating for more inclusive local policies. Experience shared consistently highlight the challenges of navigating a potentially less accepting social environment, the critical importance of finding even limited support, and the difficulties in accessing specialized resources. The Reddit threads reveal that even in areas considered more accepting, microaggressions and discriminatory attitudes are still very present. Simultaneously, a strong sense of resilience and a clear desire to foster a more inclusive future within Southeast Idaho are evident, with individuals actively seeking connection and community. Based on the data and community insights specific to Southeast Idaho, a critical social problem is the significantly limited access to affirming mental health care and support, a challenge consistently highlighted in research on rural LGBTQ plus youth. This scarcity is exacerbated by social stigma, potential isolation within the region, and the documented higher rates of anxiety, depression, and suicidal ideation among LGBTQ plus youth in rural areas compared to their non-rural peers. The rural context of Southeast Idaho intensifies these mental health challenges due to a proven scarcity of specialized providers and the greater distances required to access care, often necessitating travel to urban centers like Boise or even out of the state. Exploring the professional knowledge base continues to confirm the relevance of minority stress theory within the context of a potentially less accepting local environment, where LGBTQ plus youth report higher rates of victimization and discrimination. The social determinants of health framework further underscores how restricted access to resources, a key characteristic of rural areas, directly and negatively impacts mental well-being. Understanding the specific community ecology of Southeast Idaho, including its social norms, religious influences, and limited LGBTQ plus specific infrastructure, is vital for comprehending how the local environment profoundly influences the mental health of LGBTQ plus youth. Research on rural LGBTQ plus populations consistently indicates significant challenges related to isolation, reduced visibility, and constrained access to services, often leading to poor mental health outcomes. Professional guidelines increasingly emphasize the necessity of culturally competent care that specifically addresses unique stressors experienced by LGBTQ plus individuals in diverse contexts, including rural settings like Southeast Idaho, and the need to overcome barriers to access such as cost and fear of being outed. Framing the social problem in Southeast Idaho, it is evident that the LGBTQ plus youth in this region experience heightened mental health challenges, including an increased risk of anxiety, depression, and suicidal ideation due to the interplay of minority stress, limited access to affirming mental health services, and social isolation within the local context. Based on this analysis, the for Southeast Idaho, my working hypothesis is directly increasing the availability of culturally competent and geographically accessible mental health services, combined with targeted community-based initiatives designed to cultivate greater understanding and acceptance of LGBTQ plus youth within Southeast Idaho, will result in a measurable improvement in their mental health outcomes and a reduction in feelings of isolation. In closing, our exploration of LGBTQ plus youth in Southeast Idaho reveals a community brimming with resilience, navigating unique challenges within a distinct cultural landscape. While national data illuminates the broader picture, it's the localized stories, the persistent barriers, and the unwavering spirit of organizations like Flourish Point and Idaho Falls Pride that truly underscore the urgency of our focus. By actively working to bridge the gap in affirming resources and cultivating a more deeply understanding and accepting Southeast Idaho, we hold the power to create tangible, life affirming change for these young people. Let's commit to moving beyond awareness and towards action, ensuring that every LGBTQ plus youth in this vibrant region has the opportunity to thrive. Thank you for lending your attention and your heart to this vital endeavor. And if you're interested in learning more, here is a list of all of the references and resources that were used to bring this information to you today. And again, thank you. Thank you for your time and thank you for your support.